Nick, good to see you. Today we are talking about the ACA cliff, the $1 income mistake that could cost you thousands in health insurance. One of the biggest surprises people face when retiring early has nothing to do with investments, it's healthcare. And starting this year, a little known rule under the ACA is creating a really shocking outcome. Earning just one extra dollar of income could cost you thousands in additional premium costs. Explain here, what changed?
Right. So we saw these COVID era subsidies all of a sudden be eliminated from that Affordable
Hmm.
Care Act. They've been in play now, since COVID and giving some people some relief, and some people jumped on it, being able to earn a little bit more money or draw out more money in retirement prior to age 65 and getting onto Medicare. Being able to go on to the Affordable Care Act and get an insurance policy, which is, one of the biggest hurdles of retiring early,
Mhm.
but they're able to do that. And now, they've gotten rid of those subsidies. So those income levels have gone down. So everybody's got to be a little bit more careful on the amount of income they're drawing out in retirement.
Absolutely. Just by $1. It's incredible. So, what does this mean for the people who need health care before they're eligible for Medicare, which kicks in at 65?
Right. So the biggest thing I tell people all the time is they've got to plan for this earlier than the day they
Right.
decide to retire or the day they decide to turn on, some Affordable Care Act, type of health insurance plan. So with that, now all of a sudden we have to start taking distributions out of retirement to fund your retirement. And, from there, where are those coming from? For tax purposes, if we draw them all out of IRAs, yes, we're going to be paying, ordinary income tax on that. But, this also applies towards our Affordable Care Act subsidies as well.
Mhm.
And if we take out too much, now all of a sudden our healthcare insurance becomes that much more expensive.
Mhm. And who gets hit the hardest?
The people that don't plan,
Yeah.
when it comes to that overall, the one that just shows up and says, hey, I've got this pot of money, most of it is in pre-tax dollars. I want to start, I want to retire now and prior to age 65, and I want to start taking this money out. If we take out too much, now all of a sudden our healthcare expenses get that much more expensive. And to be frank, it's just the people that don't plan,
Mhm.
for this ahead of time.
Okay, so let's say I'm coming into your office today, Nick, to retire early. What can I do to avoid this income trap?
Right. So we need to start looking at, getting money from pre-tax to after tax, making contributions to HSAs, using cash value life insurance to be able to take tax-free withdrawals from. So making sure that we're setting up money in the correct buckets is what we ultimately need to be looking at. And it's not just trying to save taxes today. We always talk about how taxes are on sale at this point in time. We're in some of the lowest tax rates in our nation's history. How do we pay those taxes up front, but then be able to enjoy them in retirement, on more of a tax-free basis?
Right, exactly. And we are living in that historically low tax rate, like you just mentioned. And I think our national debt hit a new record over the weekend too, Nick, right?
It's constantly going the wrong
It's always
direction.
setting new record. Okay, so just to underscore the obvious, this all comes back to proactive planning. Income isn't just about taxes anymore. This is going to directly affect your healthcare costs as well.
Yeah, absolutely. It's one of those that, we're in a progressive tax bracket environment. So, it's not that all of our taxes would be taxed at 22% or 32% or 37 or anything like that. We're taxed, we get our standard deduction, we're taxed at 10%, 12%, 22, and so forth. But when it comes to the Affordable Care Act, it's not that way. Once we go that dollar over, it's not just that dollar is going to be taxed and we're going to be paying, extra premiums based on the income above, those selected levels. Now, all of a sudden, everything jumps up, with it. So we lose, those benefits once we go that $1 over on the healthcare costs.
Oof, that must be so frustrating. Well, Nick, if somebody would like to start planning now to pay less in taxes, less in healthcare, especially if they want to retire early, what's the best way to reach you?
Yeah, absolutely. They can reach out to us online, ewgretire.com, or they can give us a call, 937-498-1128, and schedule an appointment with us.
Great. Nick, thank you very much.
Thanks, Erin.